So happy New Year's, everyone. I'm Dr. Raymond Liu. I'm a practicing oncologist and director of the Cancer Survivorship Program at Kaiser Permanente San Francisco. I'm so excited today to continue our second episode of our monthly series of live virtual events I'll be hosting called Beyond the Clinic, Living Well with Melanoma. We'll be exploring how to live well despite all the challenges we're facing every day. A couple of logistics: I'll be monitoring the chat during my conversation. We really want to make this a conversation with your input, so feel free to put things in the chat and send us questions that you would like answered. If there are any important issues or questions you want to bring up, please put them in all caps in the Q&A so they can come to my attention easier. We'll try to address as many issues as we can in our 30 minutes together. So let's get started. My guest today is renowned clinical psychologist, Dr. Dwain Fehon. Dr. Fehon is an associate professor with the Department of Psychiatry at the Yale School of Medicine and chief psychologist for Yale New Haven Hospital. He's the founding director of the hospital's behavioral medicine service. Dr. Fehon, thank you so much for having a conversation with me today. Our topic today will be quality of life for melanoma patients and survivors during COVID. So welcome to the program. And again, thank you so much for joining us today.
Oh, thank you so much, Ray, for having me. It's an honor to be here. Melanoma is a great group, so it's a pleasure to be here, and I hope that I can provide something that's useful for your audience. And for those of you who've tuned in, I appreciate you being here. Thank you.
So I want to start with just an acknowledgement, because these are really hard times, and I think for our melanoma patients, our cancer patients in general, but certainly there are extraordinary times with the pandemic and everything. So want to start with that and just get your opinion about how important it is to acknowledge when there are stressors in our lives, how important it is to say that that's what they are. They're the stressors in our own life.
Yeah, absolutely. I mean, yeah, of course. And this is such an unusual, unprecedented experience in our lives. And it's something that we're living with every single day. It's been getting worse. I know in California, where many of you and your guests are, the numbers are getting worse. So this is a reality that we're all facing every day that is, in some cases, been life-threatening, life-altering for almost all of us to varying degrees. And it's absolutely important to acknowledge these kinds of stressors. That's the healthy thing to do.
So when we acknowledge it, I think the other thing to think about is, I've had a lot of my patients say, I've dealt with this type of roller coaster ride in my life with all these stressors, with whether it's melanoma or other situations in life, and it almost feels like being in a pandemic, it's like bringing that kind of, like everyone can actually feel that a little bit more, right? That folks that didn't even deal with cancer are understanding what we're going through.
That's true. I know at the beginning of the pandemic, many of my patients were saying, oh my gosh, now other people have an appreciation or a slight experience of what I've been going through as someone who's been immune compromised, who can't go to the grocery store easily, who has to always worry about personal safety in public situations. So I think in some ways, the pandemic has helped us to have a greater appreciation for those kinds of situations that people with cancer or other serious health conditions face every single day, pandemic or not.
Right. We have something in the chat right now where, when we spoke before, the idea was, we wouldn't even know what was going to happen on the day of the live event today, because, things are changing so fast in pandemic world and in the world in general. And we have a question from one of our listeners today about the COVID vaccine, right? So just to recognize that, we're in this situation where every week there's information coming out and there's changes, and it's not just the fact that there are stressors, but it's the pace of the stressors, right? That let's get your opinion on that.
Right. Yeah, I'd be really interested in hearing from the audience about what this experience has been like. What have been some of the significant challenges that you've experienced? Because, I think, we all have a slightly different experience. Some of us have lives that are completely altered through this pandemic and on top of melanoma or other cancers. And others, it's a little less challenging. I think our personality styles have an impact on how we experience this period of social isolation or social distancing. Yeah, and our own capacity to manage stress in general has a huge impact on how we're managing the stress of this COVID experience. In many ways, just like cancer, any stressful event has its challenges, right, the significant hardships, but also some unique opportunities we can think of for growth. And sometimes it's hard to think about the growth opportunities when facing these profound negative events. But when we can, it can also have a huge impact on how we experience these events and how we adjust or adapt and can cope overall.
Right. So I want to go on our website when we were talking about the event. I had one of your talks about resilience, and what a fantastic lecture you gave there. And I wanted to sort of ask you a little bit about this this idea that you propose in it, and I want to get your sense of whether I got it right, which is this idea that first of all, that when we think about mental health and stressors, that physical health is really, really important. I want to sort of talk a little bit about that and get your sense on to elaborate a little bit more on that.
Yeah. Oh, this is it's not rocket science. When we think about overall well-being or quality of life, it's a combination of factors, right? It's a combination of physical health, how we feel and how we function physically, and mental health domains, our emotional well-being, our emotional health, and at a third dimension, our capacity to stay connected to the things that are meaningful in life. You know, if I were to ask you or, the audience members, how do you define quality of life? Or how would you define your own quality of life? What makes that up? I'd like to hear from others, but my guess is that a lot of people would say, well, I know I have a quality of life when, my health is reasonably good, I'm happy, and I can do the things that I enjoy doing. So I feel good physically and mentally, and I could do things that I enjoy. And so when we're thinking about both resilience and quality of life, it's really helpful to think about both the physical and mental aspects and what we can do to maintain good physical functioning, as well as what we can do to cultivate healthy habits of mind, healthy habits of heart that I like to think about. How do we approach our life, the stressful events? I thought Randy Pausch had a good quote. If you know who he is, Randy Pausch was a professor at Carnegie Mellon Institute, and he was diagnosed with advanced pancreatic cancer. And he wrote and gave what was called the last lecture. And one of his quotes was, we can't control the hand that we're dealt with in life, just how we play it. And so, how we approach the challenges mentally and what we can do physically to keep ourselves resilient has a huge impact, I think, on our overall quality of life and our emotional well-being.
I love that YouTube video. I saw it, and it really was very meaningful for me. We have some things in the chat that are talking about some things that are meaningful for folks, including really about the importance of supporting each other and this idea of relationships, which we'll cover a little bit. I think one of the challenges I wanted to bring up, just to get to your thoughts, is this issue of relationships and relationship connectedness, because I think what we're hearing here in the chat, but what I hear with a lot of my patients too, is that connections are really important. And that goes to mental wellness, but the physical connection is what people are missing with the pandemic. And the question is, like, one attendee today says, a lot of folks are locked up, a lot of their friends are locked up, and how do we really connect in this world? Is even seeing your therapist in the virtual world the same as an in-person world? So can you talk about physical connection and relation and how we can maintain that connection?
Right. It's well recognized that isolation and loneliness are major risk factors for depression and anxiety. Right? Social relationships are key. It's part of what helps us stay resilient. When we look at the qualities of resilient people, the capacity to form and maintain relationships is one of those important factors. And I guess that's what's so wonderful about Zoom is that it does give us a way to stay connected, right? It's very different. It's not the same as having your grandkids or your kids come over to your home where you can see and touch and smell them, but it's something. So flexibility is really an important quality of resilience and mental health too, being able to be flexible and accepting of what is. And if this is the best way for us to stay connected through Zoom, then we should do it, right? So that we don't become too isolated and too alone. I'm seeing some comments in the chat box that I think are pretty interesting about the hardest things, some of the challenges, not seeing people who aren't being careful, not following guidelines. I'm assuming that means with the masks, or being afraid to go to the hospital to get scans or treatments, worrying about catching COVID, how stressors of cancer and COVID could impact each other. These are issues that a lot of people with cancer and other serious illnesses are struggling with too. Any stressor is really, it's a threat on some level, right? That's stress is not necessarily a bad thing in of itself. It's what activates us. It's what gets us to act, right? It's been part of our evolutionary success. We learn to run away from the lions and survive. So these kind of stressors, they are threats. And I think when a person is already living with a very real threat like cancer, adding something else to the plate that's threatening can be very, very scary, to say the least.
When I think we've talked about this before, which is like when those things are piling up, when there's anxiety, and there's anxiety above anxiety because of the COVID issues and what's happening with how we have to flex with relationships, sometimes we need other types of tools in our toolbox to handle that. And I see one person on the chat writing, Susan writing, what about journaling? So wanted to talk a little bit about journaling in your perspective, and a book I read recently called Gratitude Diary, where people can write about their feelings of gratitude. No matter how hard things are, there's always something to be grateful for. There's a silver lining, and to get your sense of that journaling and gratitude. And
I think they're great ideas, and I'll explain a little bit about why I think they're good. But journaling, whether it's just a reflection on your day, your experiences, your feelings, that has tremendous mental health benefit. A gratitude journal of what you appreciate or feel grateful for that day or in general also has mental health benefits. And why is that? Well, because it disengages us from more stress-laden thoughts. In that video that's connected to this program, if folks want to take a look at it, I talk about the connection between thoughts, feelings, and behavior. How we think, our thoughts, our beliefs, they shape our emotions. So that when we can step back and reflect on our experiences with gratitude, that changes how we're thinking about our situation right now. We're not stuck in a thought process of, oh, this is awful, I can't take this, what's going to happen to me, what's going to happen to the future. Instead, the gratitude journal allows you to come back to what's more knowable and understandable, and brings that stress level down. And whenever we can do anything to bring the stress level down, like journaling, meditating, yoga, hugging your partner, holding hands, it has a physiologic effect. Stress reduction strategies have a profound physiologic effect, and it benefits our immune system. We've seen this in a number of different studies that look at meditation, yoga, stress reduction techniques, that there is a direct immune system benefit when people can engage in these types of activities. So, right, so journaling, going to groups, or anything that brings that stress level down and alters that any unhelpful stress-laden thought process can be a really good thing.
Something I'm learning too, and we spoke about before, was like when I first entered this whole idea of mindfulness, when I was looking at it from a survivorship standpoint, it seemed to me, because I hadn't done a lot of it myself, that it was hard, that it would take time, it would take an investment of energy.
Right.
And I've since learned that if there is that commitment, that it may not take more time. And that's what you mentioned. And so when there's, let's say there's this flow of like, okay, well, I'm heading to my MRI, there's a lot of anxiety, I have to travel for my job, there's anxiety. Are there things that don't take extra time? Are there things that we can engage in related to being in the present that can really help us get there and help calm that anxiety and fear?
Absolutely, right. If you take a mindfulness class or a mindfulness-based stress reduction class, right, you are encouraged to do like 30-minute meditations, which are great when you have the ability
30
to
minutes.
do that. But even if you can quiet yourself for a few minutes, it matters. A little bit can go a long way, especially if you can do that throughout the day. Times when it's maybe more easy to do that is when you're transitioning to other events in the day. Before you, I don't know, just think of an example. Before you get up from the table to go do something, pause for a minute. Before you sit down to eat, pause, rest, close your eyes, breathe, relax. Bring yourself back to this moment. If you're driving home, before you get out of the car and walk into the house, stop, pause, breathe for 30 seconds or a minute, just to bring your level of physiologic arousal down. With a clear head, you can approach situations much more calmly and even-tempered.
So what I'm hearing too is just like an exercise where, it's like, it's not necessarily a 30-minute day exercise. Right. It could just be stretching.
Right, right. And did you, in the New York Times, there's an article this week about even 4 seconds of high intensity exercise separated by a minute, and then do another 4 seconds, minute break, another 4 seconds, actually has beneficial effect on muscle tone and cardiovascular health. So even these sort of micro bursts of high intensity exercise can have an impact. So can, I think, these short moments of calm and relaxation. Centering the mind, though, is a really important part of that, because it's not as helpful if you calm your body, but you're still churning on all the things that are stressing you out. Because what mindfulness does is tries to quiet the mind a little bit, to bring you back to just focusing on your breath. And again, the benefit of that is that by quieting the mind, it helps it gives space for some of the stress or emotions to dissipate, so that you can approach whatever the next situation is with more equanimity. Equanimity means it's balance, it's flow, having the ability to maintain balance even in stressful circumstances.
So I'm reading the Q&As, and there's a lot of great things going on. This whole thing about exercise, and that 4 seconds is amazing for me too, because we were just talking today about climbing the stairs. I'm on call, but let's take the stairs instead of the elevator, and that's my exercise for today so far. But I'm going to celebrate that.
Absolutely, that's right. Because how does it feel to you, both physically and mentally, when you choose to take the stairs?
Well, it feels like I was in control and I had space
Yeah,
to like make a decision about my life. And even though it only took a minute, it having control gave me sort of satisfaction in itself, just
right.
having that sense of control,
Yeah,
which is important.
exactly. Right. You feel like you're doing something positive for yourself, which is
Yeah.
terrific. Right.
Yeah,
Right.
there's
So
also, yeah,
I see Connie says, what about exercise? 5 minutes walking the dog.
yeah,
Yeah, just that. When we can move our bodies and maintain our physical health, that has tremendous mental health benefits. A healthy lifestyle, sleeping well, eating a healthy diet, exercise, connecting with people, that
right.
forms a foundation for good mental health and managing the stress of life.
Yeah, so we have some questions about, and this goes back to our acknowledgement that it's okay too to at some point just take a day for yourself too. And so David writes, one of the best pieces of advice I've received is that it's okay to have a wallow day. I love that. I love that quote wallow day where you don't get out of bed. It's okay. You're allowed one. So an acceptance of our humanity, really.
Right. We're thinking a lot more about the value of self-compassion. Right? We hear that more and more now. And that, can be an example of that, where you're giving yourself a break. I think, I'd love to hear again from others through the chat box, but I think melanoma can sometimes be one of those cancers where people can feel guilty, be hard on themselves. I should have, whatever, I shouldn't have been out in the sun as much, or I should have had that mole checked sooner. That can be really hard and add to the stress as well. And so having the compassion to say, I can't do that to myself, that's not helping me. I need to give myself a break. That's valuable, that's important. It doesn't mean that it's good to disengage completely, because that's going to create other problems. But if you feel like you need to step back for a day or an hour, and that's good for you physically and mentally, it's worthwhile to consider doing that.
What do you think about, there's a couple of questions here about the symbolism of the physician office, the stress that just seeing a doctor can create. And,
Right.
again, this is a pandemic issue where you don't have your local support because there's maybe a hospital policy or a clinic policy that you can't have your loved ones with you there. So there's a symbolism of the actual medical system that can create stress in of itself. And how do we deal with that?
Yeah, it's real. The white coat anxiety.
Yeah, people who have high blood pressure.
Our high blood, right? Our blood pressure readings are always highest at the beginning of our doctor's office, and they're lower towards the end usually.
Right.
Yeah, right. What's it like in your hospital when people come into the clinic? How are the staff?
Well, I think because we are in a surge in California, there has to be strict rules to help protect our patients. And I think I absolutely, again, this is about acknowledgement, to acknowledge that is definitely a stressor. And I kept thinking like, well, what about other ways using telehealth, for example, to bring the family in, where they can't be there physically? Is there a way to involve the family in a very active way to try to keep that connection, right?
Right.
Yeah.
I think telehealth is a huge benefit from this pandemic experience. I'm sure we're going to continue to use this into the future. But I think it can be very disconcerting when going into a clinic where you see everyone in masks or face shields. It can be pretty scary. You can't judge facial expressions very well. And so much about good care is the relationship that we develop between, provider and patient. And the masks of face shields can sometimes be a barrier. So I think it's super helpful when, physicians can be real, sort of acknowledge what is, try to be as human as possible, to try to make what is maybe a very sterile, scary experience as supportive and friendly as possible. Again, how we think about a situation has a huge impact on how we feel about it, right? So as a patient, if I'm going into clinic and thinking, oh my gosh, they're all in scrubs, face masks, this must be because there's so much of the virus around here, that's going to increase my level of anxiety or uncertainty and discomfort. On the other hand, if I think they're taking extra precautions to keep me safe, I'm going to feel very different about the situation, right? And again, my body is going to be reacting differently. Instead of being tense and anxious, I might be able to be a little bit more relaxed and comfortable with the situation.
Right. I think that's definitely a theme that I'm hearing coming out from you, that's tying in between physical reactions, our mental health, and how they just, the interplay between the two. It's so complex, and it's wonderful. And you know, yeah.
Right. So when we think about resilience, quality of life, managing stress, it's so important to have awareness of your body. What's my body doing? Am I tense? Am I breathing shallow, rapid? My heart pounding? What's going through my mind? Is my mind, racing ahead? Am I thinking about what's going to happen next? Or am I more or less relaxed, calm? Am I here in this moment? How grounded am I? And when we can kind of come to a more relaxed and grounded place, we're managing the stress of the event more effectively.
So that's really great. And I know these 30 minutes always seem to go so fast for me. And I wish we had 3 hours to explore these things. We're already at 30 minutes, but I want to just, again, there's these expressions of gratitude from the audience, and I'm grateful for that. And Dr. Fehon, I'm just so grateful for all the work you've done over the years to help people become more resilient, because I've learned something from you, so many things. And, I thank you so much for being here today. Do you have any sort of final thoughts for us? We talked about acknowledging the stressors in our life and the pace of stressors, and then, being flexible, tying the mindfulness and being present with, physical activity and connectedness. Those are all amazing ideas. And any final parting thoughts for us today?
Wow, there's so much I'd like to say. And maybe just one word or one idea of stressing the goal of maintaining equanimity in a healthy way, and trying to do whatever you can to lead a healthy lifestyle, and the value of cultivating what I would call healthy habits of mind and heart. Try to do whatever you can to stay physically active and cultivate ways of thinking that are really just healthy, grounded, and helpful. So I really appreciate the opportunity to be here, Ray. It's a pleasure. I've had a lot of fun. I'm sorry it's gone by so fast.
I know. We could just talk forever, which is the beauty of this too. And I'm hoping we can answer more questions in the future and help our patients and colleagues.
There's one person says, any book recommendations? And I'll give one real quick. It's not mine or anything like that, but there's a great book written by Linda Carlson. She's a psychologist. Not Linda Carson, Carson. It's mindfulness-based. Oh, what is it? Oh my gosh. Mindfulness-based cancer survivorship, something along those lines. If you're looking it up, maybe you can provide that.
I'm gonna.
But it's all about managing stress, using meditation, yoga, healthy lifestyle practices as a way of sort of cultivating healthy habits.
Well, I see here mindfulness-based relationship enhancement, but at the very least, we can get that information on the website, and for folks that want that, that'd be great. Thank you so much today, and for our audience, come join us for our next discussion around Valentine's Day. It'll be a very appropriate topic. We'll have our psychologist, Jamie Cohen from my alma mater, UCSF, discussing relationships, finding love as a survivor, great Valentine's Day themes. And I think, again, exploring what we talked about last time, this time, and next time, which is like the connectedness that we need, especially in these hard times. So thank you so much, Dr. Fehon. Again, just a privilege and and honored to have a chance to have some time to speak with you. Thank you so much for the conversation today.
Thank you.
Okay, thank you.